Catheter ablation provides good clinical outcome in patients with atrial fibrillation. Atrial fibrillation increases the risk of heart failure, stroke, and other heart-related complications. Some studies had shown that atrial fibrillation ablation is more effective in maintaining the sinus rhythm as compared to antiarrhythmic drug treatment. The study was performed to compare the resource use and clinical outcome of catheter ablation procedure with antiarrhythmic treatment in patients with atrial fibrillation. Individuals aged greater than or equal to 18 years, who had atrial fibrillation, and treated with either ablation or antiarrhythmic drug treatment, were included in the study. Patients who had ablation procedures performed during the 12-month pre-index period were excluded from the ablation group. Patients who underwent ablation procedure during 12 months pre- and post-index period were excluded from the antiarrhythmic drug treatment group. The retrospective study included 1,116 patients who were classified into two groups based on the treatment. Ablation group included 558 patients and antiarrhythmic drug treatment group included 558 patients. 3 months blanking period was implemented. Inpatient and outpatient visit for both the groups, in 4 months to 1 year period after index, were compared as the primary endpoint. Heart failure, cardioversion, mortality, stroke, and a composite outcome, for both the groups for 4 months to 3 years index period, were also compared as the secondary endpoint. The average number of cardiovascular-related outpatient visits in the 4 to 12 months was significantly lower for the ablation group as compared to the antiarrhythmic drug treatment group. On secondary endpoint comparison, it was found that the ablation group patients had 50% lower risk of mortality, 38% lower risk of heart failure, 43% lower risk of experiencing a composite outcome than the antiarrhythmic treatment group. The study results concluded that atrial fibrillation ablation was associated with lower cardiovascular-related outpatient visits, risk of heart failure, and mortality, as compared to antiarrhythmic drug treatment. The results imply that atrial fibrillation ablation is a better treatment approach than antiarrhythmic drug treatment, and should be considered in selected patients.